And to introduce the next speaker, before we do, I just want to mention one thing about the Northwest Arkansas Council. We all are amazing region, obviously. A lot of the reason is the leadership that put together the Northwest Arkansas Council, and then the engagement of the private sector, trying to help the public sector speed up on the right things, and just help figure out what we need to become a great region. And over the years, they've chipped away at that over many years, and we're going to get to hear from the leader. But it's a lot of times people say, "Oh, it's the Northwest Arkansas Council." It really is. A lot of the reason we're where we're at is the great work they're doing along with their members. And just a great organization. People say, "Oh, we need to go duplicate that," but they can't. There's just something about it. It's just amazing organization, amazing engagement from all the leaders, both in the private sector and the public sector, and it is kind of our secret sauce in some ways. Jeanette Baeza Collins is going to introduce our next speaker, the leader of the Northwest Arkansas Council. Everybody knows Jeanette probably, but she's one of our great assets around here that is so smart and well connected, and she's, we were talking earlier with her today, she's going to have one heck of a decade or two coming up, and hope we'll all get to reward her for all of her diligent work over the last decade or two. So Jeanette.
Thank you, Tim. It's good to see all of your faces. So Nelson at Peacock, he's our president and CEO of Northwest Arkansas Council. Tim kind of told you more about us, but for those of you who are unfamiliar with the organization, it was a nonprofit founded in 1990, really to raise the standard of living for all Northwest Arkansans. We're focused primarily on social and physical infrastructure. We look at regional stewardship, workforce development, and then economic development with a focus on entrepreneurship and innovation, which is part of the reason why I got to join the team. So prior to joining the council, and that was in July 2017, Nelson served as the Senior VP of Government Relations for the University of California, Office of the President. And to give you a sense of the scale of that role, think about 10 campuses. You've got 5 academic medical centers and 3 national labs. He also served as the Assistant Secretary for Legislative Affairs for the Department of Homeland Security and as Senior Counsel for then Senator Joe Biden. So he brings a lot of national expertise to the council from where I sit on the team. It's really been fantastic to watch. It's been a masterclass of leadership and collaboration. Many of the things that have proved difficult in the past, Nelson's been able to pull together different stakeholders, bring them around the table, and tackle the audacious goals. And so I'm excited for him to be with us today and to share more about what's been happening in the healthcare industry here in the Northwest Arkansas Council, and also about ways that the council and our members are looking towards the future after the pandemic. So Nelson.
All right. Thanks, Jeanette. Thanks, Tim, for having me. I do see some familiar faces on the screen, so thanks for having me. Tim told me told me to speak for about 20 minutes, so if I go too long, please blame him and not me. But I'll try to get through this pretty quick. One of the things I learned at my prior roles, which were managing larger organizations, was that you really need to surround yourself with people who work hard, people you can get along with, and also people that are more of an expert on their field than you are. And so Jeanette is certainly one of those. She's been working to advance our entrepreneurial ecosystem here for quite a while, and I do agree with you, Tim, that there's some really amazing things on the horizon for some of the work that she's doing. So Jeanette, thank you for all that you're doing for Northwest Arkansas. So like was mentioned, the Northwest Arkansas Council, we do a little bit in a lot of different areas. And that is, I think, the special sauce that we're able to bring people together to do their work and to bring about the best impact for the region. And so that's what we've been trying to do with COVID coming along. And just I want to give you a few examples. And the first, one of the main things we did was, seeing how this was going to impact small businesses. We really understood, it wasn't hard to figure out the impact that we were going to have, but we also saw the federal aid packages being developed, the state aid packages being developed, and felt that, you know, a lot of our small businesses, most even medium-sized businesses, wouldn't necessarily have the capacity or expertise to figure out what programs were coming online, what were the deadlines, how do you fill out that paperwork. And so what we did early on was try to create a mechanism to help with that. And, you know, we also knew that we weren't the right people to do that. And so we reached out to Mary Beth Brooks, who I'm sure you all know, who runs the UA program to help small businesses. And she was willing to do that, had a program set up, had the software to serve clients set up. And really, we were just able to help bring her some additional resources to staff up to kind of help meet the challenge. I think she's been able to increase her outreach and ability to serve. I don't know the latest numbers, but it's been by a factor of 10, 20 or more out into the community. And so, you know, that's an example of us bringing together someone with expertise and bringing some resources to help them do their job better. Another example is our workforce development team. They worked really hard with the state to get some of the online apprenticeship programs or the apprenticeship programs, get those created and changed into virtual and online programs only. And so, again, you know, we aren't the ones doing the training. The UA Global Campus is doing that, but we were able to bring the employers and bring some of the educators to those programs to help get that out. And so a lot of people are going to be able to take advantage of those programs during this time to help upskill or, you know, prepare themselves for another career. So, but again, that's just an example of what we're doing. We get some credit, but really we're just bringing people together so they can best benefit the region. And so, you know, one of the things I wanted to talk about today was, you know, what we've done in the healthcare space. And so I see some doctors on there, and Dr. Thompson, you've heard from him quite a few times, and I'm certainly no practitioner, and maybe I shouldn't talk about healthcare when I have people that can you know, check me on what I say, but I, you know, really want to talk about what the institutions here have done, the healthcare providers have done. You know, the council has not been involved in healthcare historically, but some of the council executive committee members over time have, you know, have had to leave the region for very specialized care. They've had to do that personally, or they've had to send some of their top employees away to get specialized care. And so it's always been, I think, part of the mission of the council to turn Northwest Arkansas into a healthcare destination. But I think it was, you know, it was down in the plan somewhere and really never focused on too much. But we decided back in around when I first got here, we wanted to do an analysis of the region, our healthcare, what healthcare is like, but we also want to look at it from an economic lens. And we thought that would be a better way to focus on the issue. And so in 2019, we released a report that we had hired a consultant to help us with. And basically we found that we have high quality primary care here that's low cost and good availability, but we do lack high-end specialty care. In the economic impact, this study found was up $950 million per year, trending upwards. And so that got a lot of attention from some of our stakeholders. And so decided that we wanted to do something about that. And the report, you know, establishes a plan how we're going to remedy that. And real short, it calls for additional GME slots. 200 is what we're trying to achieve. If we get 200 more residencies, and that's a big number, that will put us at the national average for resident training here. Increased research and development. The high-end specialists want to do more research. That will make us a more attractive area. And so UA and UAMS are working on more partnerships there, and I suspect there'll be some private sector investments coming along with that to help bolster that. And then the establishment over the long term of a 4-year medical school. And so all of these goals are in process. And, you know, I'm hopeful that, you know, the COVID outbreak will not completely derail them. But one of the reasons I bring all that up is because the report called for the creation of a health transformation division within the Northwest Arkansas Council. And so this summer, we created that organization, and it includes Mercy Northwest, Washington Regional, Children's Northwest, Northwest Health, the University of Arkansas, UAMS Northwest, and then the Whole Health Institute, which is Alice Walton's new integrative medicine institute, have joined that group. They fund the organization, and we actually did a national search for an executive director over the last several months, and we actually made a hire. A gentleman who is a senior executive at the Cleveland Clinic has decided to take on that role, but he is stationed in Saudi Arabia for Cleveland Clinic, and he is locked down there and has been for the last 2 months. So we hope we're going to get him sometime this summer to take on that role. But in the meantime, you still have me doing this. So I think we would probably be better served, you know, to bring in some expertise. But anyway, you know, we're hopeful that we're going to do this. And so, you know, this organization started meeting once a month to implement the goals that I listed before. And then as soon as March hit, we had our first case. We decided that we could use that forum to really help with the planning for COVID. And so we turned one meeting a month into 3 times a week. We were meeting, and so and really started going through the actual nuts and bolts planning for a surge that hasn't materialized yet, but you know, we're really concerned about it. And so, and I think that was helpful in many ways. I think, one, this was unprecedented. So each of the CEOs of these organizations had a place where they could go and they could talk through issues and help with their planning, get feedback, validation for what they're doing, you know, things like that. It also helped us kind of organize as a region about what we needed. Did we have a number of beds? You know, was there ventilator capacity? What PPE? You know, testing, all of these things that we've heard about so much that no one really talked about in March. They started the surge planning to do that. We created a model with the University of Arkansas to help us do our surge planning. And so we started that process, and a few weeks into it, I saw Michael on the screen, but the folks at Rev Unit reached out, and I think they wanted to figure out if they could be helpful. And we asked them to create a simple tracking tool that could be used for the hospitals. They could track number of cases, number of beds availability, you know, PPE supply, all of these things, so we could get a region-wide look at what we had. And so that tool is still in use today, and I assume that we'll keep using it because I think there will be some expectation that cases will increase over time. So I think this was a positive effort for many reasons, not only on the clinical side for planning for the surge, but I think it had some other benefits as well. And that was one, a benefit to the residents that live here. We were able to come together to do some joint communication. As you know, there was a lot of confusion at first about where to go, what to do, and ultimately we were able to put out some joint communications about where to go get tested, how to, you know, when to go, what not to do. You know, we didn't want to create more of a surge at our hospitals because there was already pent up demand, or, you know, there was concern. And so we're able to communicate jointly out, and we'll continue to do that as we continue to open back up. I think there's even more of a premium on communication going forward, and we're going to keep working on that and probably ramp up those efforts, but that will be done jointly. So you won't see a message from Mercy or Washington Regional, you'll see it all together. and this has created the forum to be able to do that. It has helped us with our engagement with the state. The council's not operational in any way. We have actually no official role in, I guess, pretty much anything officially. But there were times when our hospital CEOs wanted to jointly communicate to the governor's office and the Department of Health, and we were able to do that a couple of times on key issues that were important to them. And I think, we certainly, I don't know that we got any policy changes enacted, but we knew that our voice was heard. So that was another thing. And I think the place where we were most successful is with our philanthropists that had a desire to give. But the fact that the council was involved and they knew this was a region-wide effort, it made them more willing to do that. And so we secured significant gifts from the Walmart Foundation, Walton Family Foundation, and J.B. Hunt around personal protective equipment. There will actually be another large shipment delivered on Monday that we'll announce that J.B. Hunt secured for us and donated. Walmart Foundation has helped with some testing equipment, and they all came together to support the workforce. As you may know, a lot of these hospitals are actually quite empty because of the elective surgeries, decision that they wouldn't be doing elective surgeries. But we had to keep the workforce ready for a surge, and so that is an expense that the hospitals had to undertake. And so we were able to get some philanthropic support to help them support those workers. And there are furloughs, there have been, and there will be impacts, but this is going to help them at least keep that core clinical staff in place to deal with the surge. And then clearly we need these people to stay in Northwest Arkansas. There's already a shortage. So anything that we can do to help keep them here is important. And I think because we were able to tell a unified story that this was impacting all of our providers, we were able to secure those funds. And the other place where I think this is most helpful is been with our large employers, having a unified connection to them. As discussed earlier, we're starting to open back up the economy. I will tell you from our largest employers, at least our big three, they are going to be incredibly cautious. Most of them were eyeing June 1st as a date to get started. And even that would be about 10 to 20% workers coming in with screening, with, masks in place and temperature checks and all those things, and best practices you hear about. But my understanding is that they're actually going to roll that back even further into mid-June or later. No, I don't think there's been a public announcement on that yet. But we want to take their learnings and hopefully take that, see if we can communicate out to small and medium-sized businesses that may not have the benefit of robust HR departments and may not be able to follow all the CDC guidelines and State Department guidelines and put out some simple messaging that will be helpful to others. And our healthcare institutions are going to be helping us with that. So, through all of this, I think what we've learned and why the council's been effective is one, because people come to us for a lot of this, and that helps us in making our connections. But we had a structure in place where people were meeting, where they were talking to each other, where they were communicating, we were building trust. I mean, they were contributing financially to this organization. So I think that helped us when we transitioned over to planning. And then, as we've mentioned before, always try to get people smarter than you are to help you do what you need to do. And in this case, Susan Barrett, who many of you may know, the former CEO of Mercy, has been really a godsend to me personally and to the region as a whole, because she has really gotten her hands dirty, come out of retirement, and helped with this planning process. She understood what these institutions were facing. She could look 2 or 3 steps ahead because she wasn't focused on the day-to-day. And she's really made a significant contribution. Probably, most people will never know the contribution that she's made, but I'm going to sing her praises publicly anytime I can. And then finally, I would say that that just, we have a long way to go. That's clear. Our small businesses are being impacted. Healthcare institutions are being impacted. But I do think that there will be pain, but we are positioned, Northwest Arkansas is positioned to come out of this as strong as any other region in the country. One, all of our largest employers are proving their significance on a national scale, that they are necessary companies and employers. They are being challenged, but they're going to come out of this stronger. And at the same time, we're seeing anecdotal evidence that there is a desire for people leaving these metro areas and coming to more mid-sized areas like ours. So that will help with our talent attraction. We've done a few analysis or talent attraction campaigns, and it is much easier today to get interest in some key jobs that we have here than it was 3 months ago. So that is taking shape, and we're also doing some real strong work with Walmart, I think, to help take advantage of that as they hire for key positions here. So so with all that, I think that we are being challenged, but we have the structures in place, the people in place, the philanthropists in place, the companies in place to kind of bring this back and stronger as soon as we can get through the healthcare crisis. And that's just going to take a while. We have the deficits in testing that have been reported. Those are still in place, but they are improving. We have more capacity today than we did when we started, and that will continue to improve. So that's what we've been doing. The last thing I would leave you with is our healthcare CEOs. When you see them, pat them on the back, or virtually. I guess you won't be able to do that for a while. But they've really worked hard. They've made a commitment to working together in very difficult financial times, and how they're going to get these institutions through this, because we need them here. We need that base of healthcare. We need to rebound strongly, and then be in a position to meet the objectives that I put out to make us a healthcare destination over the next 10 years. That's our goal, and that's what we need to get them back in a position to be able to do. So that's all I have. Hopefully that was less than 20 minutes. So
that was great. That was great, Nelson. Thank you very much. Thanks for your time. I know it's valuable, and thanks for being engaged. Wonderful report. I really appreciate it. You're right about the healthcare, just the collaboration. I mean, a lot of what the council does is encourage and create collaboration among parties. And Susan Barrett, Jeanette, we should nominate her for one of the John Lewis Leadership Awards if she'll come down and accept one, because she is unbelievable. They got
Absolutely, we should. I love that suggestion.
Yeah, they had a signed memorandum of understanding among the healthcare providers. I mean, think about that. That's amazing. She brokered that. I think they announced that at the last council meeting. Nelson's got an incredible executive committee, but we're so glad that the rent and the cost of buying houses and dealing with children was so difficult in San Francisco that we could compete with that and recruit him out of that environment back to his home state, Arkansas. So we're very thankful that he's here, and he is close to a presidential candidate. So we got to do everything we can to keep him here in case that candidate reaches out to him and happens to win or something, right, Jeanette? So let's think about that. Nelson, thanks a lot. Questions for Nelson? Sure, you got one. I guess you had
Let me just say thank you to Michael Palladino as well. I've kind of touched on what RevUnit did for us, but, they reached out to us to offer help, and that's emblematic of kind of what happens here in Northwest Arkansas. So thank you to him personally and for his company for stepping up and, helping us get a real-time solution and, and a tool that's being used every day by the institutions.
Nelson, this is Joe Thompson. Just question in your conversations. In 2 months, telemedicine has just accelerated as people got their clinic visits in ways that previously were not legal from a CMS perspective. Are your healthcare folks thinking about what the next phase looks like? Because I don't think most consumers are going to be willing to sit in a doctor's office for an hour and a half waiting for a 10-minute conversation anymore.
I think so. I mean, there is some financial assistance that's helping with that from, I don't know if this is public, but Alice Walton is very interested in this, and she's going to be helping with that. But I do hear, and I don't get into a lot of these details with them because, you know, a lot of it glosses over me anyway, but I have heard them say that they do believe that this has accelerated significantly, you know, their investments in it, the uptick from the public that they have with telemedicine. So I think we do believe that that's going to take off. I know UAMS will be a significant benefactor in that, to expand on their efforts statewide in that. But yeah, I mean, we talk about it a bit, and I do believe it will be important going forward.
Great question. Nelson, would you mind sharing with everybody a little more on whole health and what Alice's initiative is? Very exciting initiative.
Sure. So whole health was announced, and in fact, you know, the report that I mentioned was basically the impetus for whole health. I guess Alice Walton had some injuries, and over time, you know, she had a lot of surgeries, and she used kind of more integrative medicine approaches to get healthy. And so she's been a firm believer in it. And at the same time, she thought healthcare was she didn't want to invest her money in it because she thought that it was, you know, not a good investment, that there was a lot of waste, and she didn't want to use her money that way. When we did our report, I think we showed a few things. One, that we had a good base here in healthcare, and two, that there could be a significant economic impact on the region. And so I think this spurred her to think more specifically about her institute. And then a year later, at the you know, the winter meeting this year, she announced the Whole Health Institute, which she has hired a woman named Tracy Gaudette, who was from the Veterans Administration and Duke University, really to develop a model around integrative medicine to start in Northwest Arkansas. Obviously, there will be strong connections with Walmart and our large employers. And then bringing those integrative approaches here in Northwest Arkansas, and then expanding that across the nation. Ultimately, she has brought in a lot of different individuals. Any potential medical school would have whole health integrative philosophies as part of it. So really doing a lot there, you know, staffing up, getting ready. I think, you know, this COVID has set back the timing on that, but they were planning on an official announcement with all their priorities this summer. I don't know what the status of that is, but I will tell you that it's going to be a significant undertaking. Lots of national experts are being hired and relocating to Northwest Arkansas to do this. And as part of this group, our hospitals are going to be full partners in how this gets implemented in Northwest Arkansas.
Great. And again, another collaboration point there in there. And it's, you know, I think Alice refers to what we have today is more disease management. And it's nice to hear that they'll be collaborating to also be on the offense on how we get healthy before we get the disease, right? How we stay healthy, those kind of things. Okay. Thank you, Nelson. Any questions for Nelson? So does anybody have a nugget or a piece of information or a question, or this is the open part of the CEO forum where you're welcome to put forth something you know or knowledge or some report. If Gabriel or Dumas Garrett are on the line, we'd love to hear how manufacturing's performing. Gabriel, might you be on there, or Dumas? Nelson, thank you. You don't get to.
Tim, can I make a comment to Nelson for just a moment?
You bet. Bill?
You know, I'm down here in the Fort Smith area, and it is nice to get the full report of what's going on in the big picture. I think oftentimes in the news we don't get that that perspective. So it's nice to see all that's going on, and the changes are I guess, steadily occurring. So thank you for being involved in that and letting us know all the steps that are either have taken place, are taking place, or are at least in the planning to continue expanding our reach in the region as well as the nation.
Yes. Thank you, Bill. It's a great culture. It's key to our success. We don't have enough.
And just after that, Dr. Thornton, we have been in touch with your osteopathic school there. If we can create these new residency slots, I know there's a lot of graduates coming out that we will need to find residencies for. Right now, Arkansas is a donor state, so we graduate more medical students than we have residencies for, and so most of those students leave the state to do their training and they never come back. So there's a significant workforce element around increasing these residencies, because basically we educate these kids from elementary school, high school, college, medical school, and then we send them away to do their medical training, and the stats show that they're more than likely going to stay where they do their residency training. And so, there's a lot of workforce implications to this, and it needs to be a broader than a Northwest Arkansas strategy, a statewide strategy of how we increase residencies in communities across the state.
Great. And you mentioned Michael Palladino. We also have Michael Rev Unit is a wonderful company, and if you're working to digitize your organization and come have the ability to really be at the very, very front of the digitization and how you serve your coworkers, as much as Michael and his team can do a lot for us. So think about that. You might could get him to spend a little time with you. He's awesome. And we got some tech leaders that are amazing. Stan, Movista, the culture is wonderful. They're really focused on community and building great companies. And Michael and Stan are at the top of that group. Stan's a member of the council. Okay, other things people would like to ask or bring up? Well, it's going to be a time that things are going to change pretty rapidly. We'll continue to do this for weekly for a little while longer. We were going to have Tommy Van Sant speak next week on dealing with adversity and how to go about that. He's done that as beautifully as anyone. Say a little prayer for Tommy. He was in hospital with pneumonia. He hadn't been in the hospital for several years with pneumonia, and he's had a couple of second bouts this year. So say a little prayer for Tommy. We all love him, and when he gets feeling like it, he will come on and tell us how he went about going about his adversity. And one of the things he says is figure out what you're grateful for. So, while we deal with all this, let's be reminded of what we're grateful for, because in his case, he says, I'm grateful for my breath each morning when I wake up. So there's a lot we could be grateful for, and I think that helps us deal with all this negative. We'll be better for it. Anytime we have adversity, we grow, and it's an opportunity for all of us to show who we are during adversity. I hope you'll consider that. So with that, we'll wrap up today's meeting. We will stay open in what we call the Zoom room, which is this room. And so we'll just stay here and we'll be available. Everybody else that wants to go and has a busy day can click out. Anybody who wants to stay on, ask a question, share a problem, or need a resource, we're here.